All righty. Hello, everyone, and welcome. We are so excited for you to join us today for our UltraClear webinar with Onwin Ophthalmology. If you have any interest in laser treatments or in rejuvenation, we're going to explain what this laser is all about, what it can be used for, why you might consider it over other treatments, and why we're so excited for this new device. While you're getting situated, I'll tell you that not only do we have a great presentation prepared to educate you on this brand new device, afterwards we'll have some time for a Q&A session with Dr. Nguyen and Dr. Rajoub. So, if you have any questions during the presentation, feel free to put them in the little Q&A box right at the bottom of the screen. And if you have any questions or technical difficulties, you can use the chat feature and I'll be here to support you. We also have an exciting promotion, so make sure you stay tuned until the end of the webinar, and I'll explain how that works and how you can claim the promotion. And before we get started, let me introduce you to our wonderful speakers. Dr. Nguyen is a board certified ophthalmologist with 15 years of experience to specialized experience in vision correction surgery and treatment. She completed a fellowship in cornea and refractive surgery at Harvard Medical School's Massachusetts Eye and Ear Infirmary and has extensive expertise with multiple state-of-the-art laser systems. Dr. Rajoub is a board-certified ophthalmologist specializing in aesthetic and reconstructive oculofacial plastic surgery. She completed a fellowship in oculofacial plastic and reconstructive surgery at the University of North Carolina with expertise in cosmetic eyelid surgery, facial rejuvenation, and advanced laser treatments. And without further ado, Dr. Nguyen and Dr. Rajoub, please take it away.
Thank you, Rob, for this introduction, and thank you everybody for being here for this presentation on the UltraClear. This is a generation skin laser that's going to change the way that we treat your skin from texture to laxity to pigments. And the purpose of this presentation is again to address the common questions that usually people have. So, what is it? What can it treat? What kind of who does it treat? What kind of what does it look like? A treatment looking like? And then we'll have a before and after picture so that you can see for yourself the result that it can get. So most of you are already patient of the practice or friends and family. So don't be a stranger. Ask away. We're here for you. I'm going to show you this little. Oh, that's here. So this is a first cold ablative fractional fiber laser. So that's a lot of words, but in a way, it's very easy to understand. What the laser does is that it will vaporize a tiny column of tissue and that will promote collagen production. And it produces less thermal damage than the traditional laser. So because of that, there's less downtime, less pain during the treatment. So let's just watch this little clip first. The first that is coming. Oh. Okay, all right. So who's a candidate for Ultra Clear? Essentially, anyone who wants good skin. The Ultra Clear can treat uneven skin tone, texture, fine wrinkles, lines, any type of scars, whether it's going to be acne, surgical, it could be treated on the face, on the body, any pigmentation concern, brown spots, melasma, sun damage, age spots, and overall just skin rejuvenation. It works great as a prejuvenation tool for patients that are in their 20 and 30s. And then when you get to your 40s, 50s, and 60s, and that's when you want a little bit more collagen production and skin tightening. So the laser can dial up the treatment to address these concerns. And the other thing I want to add as well is that this laser works really great for the crepiness in the neck area, the jawline, the jowl area, the lines around the mouth, and the peri-orbital area. So this laser here is a little different than the traditional laser because it uses a different technology. So it delivers very fast micropulses that drills into the dermis at different depth that you can set. And it causes also less thermal damage around the area. And because of that, it's more comfortable for the patient and the skin recovers a lot faster as well. So with this laser, you can have a very quick treatment that's going to be the or most superficial treatment that's called 3D Miracle. That's about 10 minutes. You can do it without numbing. The skin will be red for the first day, will peel day 2, day 3, and then you're back to normal. But that is not the only thing that the UltraClear can do. It can also treat multiple skin concerns in a single treatment. So it can go deeper into the dermis, cause more collagen production and skin tightening, and then you can add on top of the same treatment skin resurfacing to address texture as well. And the amazing thing about this particular laser is that it can be customized to your skin needs and concern. So you can treat a neck area that's going to be different from the jowl area, from your face, and then also the chest. And you can also treat the hands. And you'll see later the before and after pictures, and you can see the result, the amazing result that the laser can produce. So essentially, it gives you the same result as a traditional laser with less downtime and less pain. So this is the Fitzpatrick scale that we use in aesthetic, to assess the risk for a post-treatment hyperpigmentation. So whenever you use an energy-based device, the skin will react and cause pigmentation. And usually when I do a laser treatment, I'm more concerned about the type 4, 5, and 6. So this is like my skin, Asian, Hispanic, Middle Eastern. We tend to hyperpigment a lot more when we have a laser done, especially CO2. So CO2 can treat skin type 2 and 3 very well, but you have to be careful in skin 1 and definitely skin 4 and 5 and 6. You have to be very careful. This laser can address a wider range of skin type just because of the way that the energy is delivered into the skin and also because of the more controlled heat damage. So you want some heat, but you do not want too much heat.
Okay, so I'm going to review a little bit of anatomy so that we understand what it is that we're treating, what the layers are. And we keep saying that this treatment is customized, but we'll explain a little bit about what that means. So we're looking at the skin. We've got three main layers: the epidermis, which is the top layer, the dermis, and the hypodermis. So the epidermis and then mostly the stratum corneum, that's that dead skin. The stratum corneum is that dead skin layer, and 3D Miracle works on that layer to kind of give you a nice polish and glow, get rid of those dead skin cells. In the epidermis, we have some pigment. That's where some of the pigment is, pigmented cells. And then the dermis is where a lot of the collagen and elastin is. So this is where that moderate treatment is called the UltraClear. Or ultra, and that's where we can start to improve a little bit more on the browns, the textures, the pores, and help build some collagen. Finally, there's laser coring, which is really unique to UltraClear, and this basically helps to deliver the energy through all of these layers and helps to really tighten and lift and help build some collagen. So there are 6 or 7 different modalities on our machine that we can utilize. So we're really looking at what are your goals? How much downtime do you want to give us? And how fast do you want to heal? And we might maybe start with a more customized, advanced treatment, and then we maybe maintain you in a more superficial treatment, or we might start more superficial until you get a sense of what it feels like. So that's the nice thing, is that when we see you in consultation, we'll talk about what you're concerned about and what we can do. So three main things to think about. We've got the superficial mode. This is the terms you'll hear: 3D miracle or clear. And pretty much this is going to help polish you, help with the texture, pigment, give you that glow. Really minimal downtime. Procedure maybe takes about 15 minutes or so. Good for, safe for all skin types. And you can, maintain your social events and work. If we're doing a more moderate treatment, then we're talking about ultra. This is deeper and more in the dermis layer. And this is going to help with everything that 3D Miracle helps. But in addition, fine lines, deeper wrinkles, and even scars and acne scars. This, and we'll show some before and after photos, and we'll show some of the healing progression in some of the further slides. This might need a little bit more downtime, 3 to 5 days. You might be, red, a little swollen, see a little bit of the grid marks. And then we have our advanced modes. This is really looking at laser coring, looking at customized treatments where we might layer all three of these at the same time. We might want to go deep to kind of help with the jawline, help with the jowling, the nasolabial folds, the neck, as you can see in that photo on the right. And this might, depending on how much we're treating, we might need a little bit more downtime, and we'll go through some of these healing photos. So just a little bit about Aclaro. So with UltraClear, Aclaro was founded in 2018, and UltraClear launched and was FDA approved in December of 2021. It's cleared for fine lines, wrinkles, age spots, scar revisions, skin resurfacing, and we've got more clearance in May 2024 for benign pigmented lesions and vascular dyschromia. And this is really kind of groundbreaking because it really changed everything along the line of lasers. We're back in the early 90s was when we used to, CO2 came out, and that was kind of considered the gold standard. But as Dr. Mann said, we cannot treat every patient with a CO2, or we cannot treat them safely. And so that's why this is really important. So why can we treat people safely? Why is it less downtime and less pain? I'm going to explain kind of this technology. And what we see is that we're able to customize how much heat we're putting in versus how much rest we're giving you from that heat. So we can change these coagulation modes and maybe provide some heat and then some rest, and then some heat and then some rest. And then for a patient that maybe can tolerate a little bit more, we can increase that coagulation or decrease it however we need. And so this allows the treatment to be more comfortable and allows you to heal faster with safer results.
And I'm going to add that you can see that these are micro pulses versus the long pulse of the CO2. So that big long pulse causes a lot more thermal damage around the area you treat. So you have necrosis and you have more longer healing time. And that's the reason why in CO2 it takes a lot longer to heal. You have 14 days of downtime.
Mm-hmm. All right, so this is what the treatment looks like, and we'll start the video and kind of give you a little idea. So as you can see, we'll always protect the eyes. If we're not going really close up to the eyes, we might just put a little sticky tape or a little shield over you. We can treat all the way up to the lash line and even on the top eyelid by putting shields in the eye as well. So again, it depends on your consultation and what our goals are. As you can see, when it's vaporizing the tissue, you're seeing these little white dots, and these are the little microchannels. And this is how it would look.
It's extremely fast. It's faster than the other traditional laser. It's 5,000 hertz compared to the other laser. It's about 1,000.
Yeah. So, we could treat the full face, even up on the nose, up on the forehead. We can get down to the neck. We can even do the chest area. Definitely another important one is around the mouth and lips as well. There we go. All right. So again, it really depends on what the treatment is. Something that's more superficial, like a 3D miracle, may not look like this, but this looks like a deeper treatment. And so maybe, more advanced customized treatment. So you can see immediately after, there's a little bit of pinpoint bleeding, as you can see in this patient's cheeks and around the eyes. And the next day after, you're going to be more swollen, increased redness, increased swelling. And then you can see very quickly by day 4 that's dramatically improved. And during this time, we're really just doing a lot of moisturizer, gentle cleansers, and sunscreen. You can see how incredible this patient already looks by day 5 and 6, able to wear makeup again, able to go out in public. So really very little downtime compared to some traditional lasers. Here's another treatment, also on the more advanced side, definitely more moderate to advanced type treatment with coring and ultra. You can see a lot of redness and swelling in the first day or two, and very quickly, and it's incredible, by day 4, this patient's looking really good.
The skin just looks shiny over there because of the occlusive moisturizer that we want you to use.
So this treatment, you can tell, is really just customized to this patient, really around the eyes. You can see by day 3 with some tinted moisture, some tinted SPF, a lot of that gets covered. And every patient is going to heal differently, is going to heal in a different amount of time, but pretty much within 4 to 6 days, we should be looking pretty good. This is an acne scar treatment, so this is an ultra mode. This is that moderate treatment, moderate depth. And you can see, immediately post-treatment, you're going to look a little red. It's going to feel a little spicy for a couple of hours, but after that, it only improves and everything kind of cools down in the face. And you can see day 1, incredible difference from compared to immediately post-treatment. By day 7, there's really no more redness.
So we're going to go over the different type of, there's 3 type of treatment: the superficial one, the one that is moderate, and the one's more intense and severe, and showing you the before and after. So this is great for people who just want a refresh, just a skin refresh, that glass skin that you want, and it could be done at really any age range. This patient here, as you can see, there's an improvement in skin pigment, and also you can see how the light is bouncing off the skin more, just giving you the glow. Same thing here, again, improvement in skin texture, in skin pigment, and just an overall glow. And same here as well, improvement in texture and then pigments, which is pretty good for this type of treatment.
And I'll just note that a lot of these, you can see it just says after 1 treatment. The 3D miracle can be repeated, as frequently as every 6 weeks. It really just takes about 15 minutes. You don't even need any numbing medicine during this treatment.
And that we can do on any skin type.
Correct.
Yeah.
So the more moderate, I want to point out, you can see this is an Asian patient, so we're talking about the Fitzpatrick type, so we can treat a wider range of patients. This is just 5 days after 1 treatment. You can see how much improvement we have in the pigment, the texture, the pores, the acne scars already, and this is with the clear modality. Again, with the higher Fitzpatrick type patient, you can see this patient, the pigment, the glow, the overall, you can see in the cheek area, how much brighter everything is looking. And we can, this is a large seborrheic keratosis around the eye area. And using the clear mode, we're able to, this is just 2 treatments, able to erase that pigment safely for this patient. Melasma is a really tough one to treat as well. So we've got this pigment. You can see this is after 2 treatments. And the patients even maintained this 10 months even after the treatment. So with that pigment improvement. Same patient here on the other side. We can also treat other things. So we talked about the neck, the chest, even the hands. These are these sunspots. They say the hands kind of can really show the aging. So you can treat other parts of the body as well. Scars as well, whether it's a surgical scar or acne scars, but this also improves in the scar. You can see how much, more customized treatment here. So this patient probably got a mix of, the deeper modalities, coring, ultra, as well as the more superficial. You can see how much improvement there is in the marionette lines, the nasolabial fold, even just along the jawline here. Obviously, the pigment, the texture, look at the forehead and the cheeks. We can get really close up to the eyes, as we mentioned, very safely around the eye, and this can help. So this is a non-surgical result to really help tighten that lower eyelid area. Here, a lot of the reds, right? So if we look at the chin and in the middle of the face, you can see a lot of the red and pigment here is immense improvement. This is just 1 week after 1 treatment. Same thing here with a lot of pigment, texture, fine lines. Patient as well, and we're happy to come back to any of these photos. You can see the deeper acne scars here, deeper lines and wrinkles. Again, pigment is picked up as well.
And then the jawline, you can see how
a lot more
there's a lot more
defined in the marionette lines as well. The neck is a big one. And so, the neck tends to always heal slower than the face. And so that's why this is great because we already know that we're going to have um, a faster healing time. And so this is after 1 month after 3 treatments. You can see the crepiness and the texture in the neck. Again, a lot of acne scars. And so this is, so some of our moderate treatments, we typically, want to consider 2 treatments. We said, 3D Miracle maybe every 6 weeks, but the more moderate, maybe every 3 months, because we are trying to rebuild that collagen, which can keep working for 3 to 6 months after a treatment. A more customized, more advanced treatment, maybe 6 months apart. So this is after 2 treatments. And this one's really, wonderful. You can really see along the jawline and the marionette and the neck, a lot of good lift and tightening. Here, a lot of acne scars as well. The pigment here is incredible. So when we're treating, deeper, yes, we're building the collagen, but then we're also getting that superficial layer. So when we say that we're customizing, we're going, we're trying to hit all of those layers of the skin that we talked about. So laser coring is really unique with UltraClear. And, some patients are not ready for surgery, not ready for a facelift, but we want to tighten. And the way that laser coring works is very unique. And so we're making these micro channels. This Helix technology is bringing down this energy. I'll let you see in the video here. So it's making these channels. It's going through all of those layers. It's treating that superficial layer. It's treating that epidermal layer. It's treating the dermis. It's going all the way down deep to help rebuild the collagen. So as we create this thermal damage, then the tissues we've cored out, we've ablated this part of the skin. Then it wants to heal, and as it contracts, it gives us that tightening and that lifting that we want. And that's where laser coring is really helping with the deeper lines, the deeper areas that need a lot of lift and tightening. See this patient after 1 treatment of coring. You can see the neck, again, we keep coming down to the jawline, the marionette, the nasolabial fold. And again, her pigment's incredibly better. Here's the neck. This is, again, just 1 treatment. Recommend, you could do every 6 months. Here's the neck. And
I think this is the same patient. So
around the lips as well, and that chin, all of this texture and the lines. And up around the eyes. So, fine lines around the eyes, you want to be safe and we want to get some good results. And not everyone is ready for surgery, or in surgery, you cannot just cut out that skin, but we want to tighten it another way. And so this laser really helps us to tighten the skin around the eyes in a safe manner. We'll turn it back over to Rob.
Yes, thank you so much, Dr. Rajub and Dr. Nguyen. Tonight, we have a very exciting promotion for everybody. So, everybody who is in attendance this evening will be eligible for our BOGO 3D Miracle promotion. And that entails buying one 3D Miracle treatment and getting one for free, which is a steal. However, this can apply for you and a friend. If you would like to schedule that for you and a friend, the free promotional 3D Miracle can be applied to you or a friend. I would also like to note that if you do choose to proceed with a higher level of treatment, such as the UltraClear or laser coring, you will also be eligible for that free 3D Miracle treatment, which is great for things like maintenance, for maintaining those results from those deeper levels. The only caveat, and it's not much of one, is that you have to book by January 31st of 2026. So make sure you book your treatments in that time span and you will be eligible for that treatment. And I'm putting a link in the chat right now where you can click on and it will bring you to our booking link. And at the very bottom of the first selection, you will see the cosmetic consultation option, and that's the one you should choose to proceed. Alrighty, so now we are ready for our question and answer section. So if you have any questions, now is the time to put those in the Q&A feature. We're here with Dr. Rajub and Dr. Nguyen for a live Q&A session. So any questions you may have now, please feel free to ask. Otherwise, they will be more than happy to address that during your consultation. And we do have one question. The first question will be, how long do the results last?
Yeah. So, anytime we're working in anything, surgery, lasers, whatnot, we're trying to um, first try to kind of get that skin back into better shape, but we also have to maintain it. So we know that everyone everyone's skin is so different and we have to customize this treatment to you. And so while we know that there might be a safe way to maybe retreat you, for example, within 6 months or 3 months or 6 months, um,
So the way that I would answer the question is that there's not only one modality that is going to fix everything. So I think that usually the result will build upon itself. So you keep on building that collagen so that's building the volume and also using good skincare too. There's a lot of regenerative medicine that we can add on top of that we can teach you to use to maintain the result in between. So essentially, you're not losing the effect, you're building onto the effect.
yeah, and in the beginning, we will want to make sure that we're addressing certain things, but then maybe we change you from a deeper setting to a lighter setting or vice versa. And so it really just depends on what we're working with.
Absolutely. All right. The next question is, how soon can I have a consultation?
Tomorrow, the book.
Yes, exactly.
Yeah.
So yeah,
Uh,
definitely just reach out to the team, and we'll try to get you scheduled, as soon as possible, whatever works in everyone's schedule.
Absolutely. And then the next question is this a possibility for patients with vitiligo?
Yeah, I think that laser is something that is you have to be careful when you have this skin condition.
Definitely. And depending on your case, your doctor can definitely assess you further at your consultation. So it's definitely always a possibility.
The laser is a tool that we use to address certain concern. So it is as good as the person, the operator. And there's all certain skin concern that we do have to address. We have to make sure you don't have any skin cancer. We have to make sure that you don't have any condition that we have to treat beforehand. So a consultation is very important.
All right, our next question is, which would help with surgical scarring from lower eyelid surgery?
Which treatment modality? Typically is ultra to help with scarring.
Absolutely. All righty. And the next one is, can a trial be done on a test spot to see if you're a good candidate before the full face?
Yeah,
Absolutely.
definitely.
Usually we do it behind the ears because if there's pigmentation concern, then you don't see it. If that's what you want to do, yeah. Mhm.
Awesome. Alrighty. And then the next couple of questions are about the costs and any financial options that you have, financing options.
Yeah, we have financing options for anything in the practice, really. We go through care credit. And about the cost, it depends. It depends on the customized treatment that we will design for you. It could range from anywhere from 800 for a treatment or plus, or for the more customized ablation, it's going to be in the 2, 3,000.
Yeah, so it'll depend on, what mode we're thinking about. Are we just going to do the superficial, something like clear 3D miracle versus ultra versus coring? And so we'll have all that pricing available for you up front.
Awesome. We also just had so we have a couple people asking where the link is. It's in the chat feature. You can also go to the website, which is virginia-lasik.com. And there is right on the home page, there is a Book Now link that you can click, and it will bring you to the same page as the link in the chat. Somebody's also asking, what is the practice code for scheduling? You shouldn't reach that screen if you used the link or the Book Now feature on the website. So perhaps there's an issue there, but typically there's no practice code that you have to enter.
Mhm.
Um, and we have another great question here. Does it matter if I've had Fraxel before?
I've had probably every single laser that is in the market. So we rotate through every month lasers. I've had CO2, I had Fraxel, I had Moxie, I had Halo. So yes, these are just additional treatment that you can do for your skin, and they're all comprehensive.
Yeah, and when we talk to you with your consult, we'll see when the last time is that you had a treatment, what skincare products you're on, what medications you're on. We'll go through all of this stuff to make sure that we're completely safe for you.
Absolutely. All right. We've got another question here. We've just got a few questions left. Is there any risk involved or possibility of unwanted results?
Anytime you do any procedure, there's always a risk. And that's where a lot of the consultation comes in for us to learn about you. We'll ask you really detailed questions about how you tan or burn in the sun, how what's happened to you when you've had a cut or some sort of a scar. And that's where we sometimes might maybe start at a low setting to just feel out how you respond to the laser before before we go any higher on any of that to eliminate that. That's never our goal. We always want to practice safely.
Absolutely. So we have a couple of other questions for the night. Um, Somebody wanted you to repeat the answer about how long the results last. If you're looking for tightening and lifting, how long does that generally last?
So collagen is still building for 3 to 6 months after the treatment. So even when we do a deep coring treatment, ultra, we know that we're not going to get that final result for 3 to 6 months. We'll see you back at like a month. We'll see you back at like 3 months. We might know that you still need to stack your treatment and do a second treatment. But there's always this maintenance that we have to keep building and improving upon our skin and our collagen and
Yeah,
elastin.
it's a hard question to answer because as you are building collagen, you also continue to lose collagen over time as well,
Mhm.
right?
And we
And
might take away pigment and then you go out in the sun, you repigment, so we're constantly trying to work with.
So it's easier to answer if there's no change and then you just do the treatment and you maintain the result. But over time, as your skin age, you continue to lose collagen.
yes, and unfortunately, there's no cure for skin aging at the moment. This is just one of the best options to help rejuvenate that while you do age. Um, Another great question here. Can we get treated even if we've had Botox treatments done already?
Yeah.
Yep.
Yes.
It does not address the same thing. So Botox relax the muscle. This is addressing skin texture and then tone and then everything else. But yes, those are all additive treatments.
Mhm.
Awesome. And one final question here is, how long do I have to stay out of the sun for after
We
treatment?
knew that was going to come. We discussed that forever.
Is it forever?
We
So it's very important, definitely in the immediate time period right after that laser to stay out of the sun because you have all that heat in your skin still. However, right before any treatment, even after treatments, sunscreen, sunscreen, sunscreen. I've got some lovely, amazing friends that are very good about wearing their visors when they're out and about as well. But yeah, definitely want to be protecting your skin.
I just think that staying out of the sun is good practice. That's why when you go to Asian countries, you see that even if it's hot, they are covered everywhere,
Yes,
whether they've had laser or not.
absolutely. Um, and I see that one person is having difficulty with the booking link, and you can absolutely call to book, but the best time to call to book would be tomorrow morning, and we will be happy to return your call and get you scheduled as soon as possible. So fear not if you are not able to book online tonight. If you call tomorrow morning as soon as we open, we will be sure to get you on the schedule. So don't worry. And obviously, just let us know that you came from the webinar, and we will be happy to help you claim those promotions. Well, Dr. Nguyen and Dr. Rajoub, thank you so much. And thank you, everybody tuning in tonight. We hope to see you in the office very soon.
Thank you all for joining us.
Thank
Thanks.
you.